want to bump her, I always think about it as like with minds, right? You just want to bump them to the right or left. You can't really change them dramatically, by being like, what you want to feel is really, really strong. Like you want to feel strong because she's right. So, I mean, this is like nobody would ever say this who does eating disorders, I think, but me. I don't know why, but like just the way people talk about it, like she's right. Like everybody feels better and better looking and all the things, right? When they're embodied. If you take 100 people and have them, we know from like scientific evidence that if you take 100 people and you have them like run 3 miles a day, none of them will lose weight. So it has nothing to do with weight. But what you will happen is they will all perceive themselves to be thinner, or better looking or something. They're embodied and they feel like they're sort of in control, not in an eating disorder way, but in like a good way of their like the input their body's getting, for instance. Like that's the bump. You want to like give her language. She's only 14. But I'm like, strong's the new skinny, like muscle's the new, because it's true. I mean, things move around all the time, but I will say things have changed. I'm old enough, to have watched this long enough to see that there's a lot of different things going on. We are in a particular phase of small bellies this year. I mean, it's like back in fashion, right? So it's hard on teenage girls. Like when you're older, you're like, okay, look, I've never had a flat stomach, and like the likelihood of me having a flat stomach is low. I'm 48, it's like whatever. But when you're 14, it doesn't feel that, that's not the world they're living in, I'd actually say yes to her, but I would like be feeding her that. And I'd be like, there's nothing wrong with a 14-year-old girl like working out, and she's going to think to herself, I'm going to get thinner the whole time, but you just have to try to counter it as much as you can. Listen, you can't get somebody out of wanting to look a certain way or to modify their body. It doesn't really work that way, right? Like no one works that. No one wakes up themselves in the mirror and goes, I'm 100% killing it. Like, I can't believe how good I look. Like, I just can't believe it. Like none of us do that, right? Like that is not what happens every day. So for me, I always try to keep it in mind. Okay, I got a 14-year-old girl. She doesn't know anything yet, but she is a person and she's comparing herself to other people. And that's the issue, right? And so like influences that show that you can look really good in so many different ways, but also acknowledging the really good, I think is like so important. You know what I mean? Like any message that I think in this population, if you put out there that it doesn't matter, you're done. Couple it with like external scientific things. It's like you have to get everything in there at once. Like when you put, like go online and find all the studies. If you take any group of teenage girls, this is true for every age actually, but if you take any group of teenage girls, there's a whole ton of studies on this, and you show them people of different sizes and ask them to pick what size they are always wrong by 2 sizes. Not sizes like clothes sizes. I mean, like, here's 5 bodies. Which one are you? And you've got someone who's like super thin, pretty thin, sort of like in the middle, a little bit overweight, and like, super big. I don't even like to use the word overweight. I'm sorry I did that. I apologize. But you know what I mean? Just like different bodies. And it's always 2 up. Doesn't know that she's body dysmorphic. I'm sure she is because everybody else is. So what's so special about her? So this kind of information, like, oh, because at 14, I have seen 15, 16-year-old girls do this. They go, well, if that's true, then do I look like that? And I'm like, that is exactly what you look like. That's cool. I don't believe you. I'm like, take this home and read it. Tell me what you think. Like, that's the discussion though. It's like, oh, so I mean, I've had like young girls like be like, oh, so I'm body dysmorphic. I'm like, yeah, you and everybody else. Your mom's body dysmorphic, your sister's body dysmorphic. It's just it's part of being human at this point. So it's okay, but you should just know the facts. And then I joke, you keep it light. Like, me too. Like, I see myself and I see a middle-aged bald guy with a pot belly, but I really know, that I'm like a super hot 20-year-old with a six pack, because like, you sort of like, you massage it for them, so they start to see it. I say, look, I'm like in my 50s, I've been obese, and every day I see myself and I see a super, super, super fat guy. And I use the word fat on purpose because
Mm-hmm.
that's how people speak, And then they say, like, you're not so fat. I'm like, I know. I also know that, but that's what I
Mm-hmm.
see. And I totally understand. And then in addition to all that, you got to play the other side, which was my point before, which is like, it's totally normal. You should totally like do it, but you want me to show you yoga so that you're as strong and you have as much muscle definition, not like losing fat muscle definition, but like just muscle definition, as you can or whatever. Like, I'll show you some stuff to do. There's nothing wrong with that. Just know that your body is what it is. Like, there's another side to it. You know
Yeah.
what I mean? And the thing you're going for isn't realistic. See, the thing I've learned from working with eating disorders is that if I don't get in on it, they're going to do something else. So they
Right.
start running 10 miles a day. You know what I mean? Stuff like this happens all the time because it's like, if I'm not in on it and, negotiating how this exercise works and what's like reasonable and what's not reasonable, it can
Yeah.
go very, very bad. So as long as you're in on it, it's going to be good because you're like a positive influence. You're right. I
Yeah.
mean, and honestly, yoga is like one of the best things because like it's not a giganto calorie burn. It's like not a great way to lose weight calorically. So, you know what I mean? She's not in some sort of really intense thing. Like even power vinyasa is nothing. It's like it's nothing compared to what you could do, if you were really trying to like lose weight for your mom's wedding, right? So many women, especially, have been saved from their eating disorder by yoga, like saved, right? And part of it is you got in there because you were moving around, you thought it'd make you look better. Like that was in there.
Oh yeah.
All those women in yoga studios are not all there because they think it's going to make them look worse. And it's not a meditation class. You know what I mean? There's a thing to it being exercise. So, it's just what you see is like that slow transformation from like sort of like bad body image anorexic thinking to like health and does this class make me glowing versus does this class make me thin? Right. So you've got like Western medicine who are diagnosing, and then you've got yoga therapy. Ayurveda is sort of like an in between, I would say, but yoga therapy is influenced by Ayurveda, where you're balancing certain things to get results. So, like, this is not a criticism of you. I'm just going to say it this way because it's going to be helpful. There is no reason you shouldn't doshically balance somebody for a hormonal result, like zero. It's just what you got to remember is like nothing is studied, right? If I take 200 women, because I've done it, right, with various hormonal issues and apply the frameworks I have to them, a lot of them will get better,
Yeah.
you know. But my little like personal practice study, I mean, in New York, all the time I had people coming to me because they wanted to get pregnant, which I
Mm-hmm.
thought was like, I wasn't, clearly I wasn't like, yeah, you'll get pregnant after 4 yoga therapy sessions. But, the way we look at it is like, okay, let me talk to them about everything. And then what you always land on is something, this is what happened to me, is like really obvious, like you're so pitta imbalanced. Like, that's like where we land. And I'm going to teach you how not to be, and then we'll see. We'll see. But that's how yoga therapy works, all of it. If you use the Koshik model too, is like, is there a problem? Is there a Koshik problem? Like you've got somebody with estrogen dominance and reverse breathing. You teach them how not to do that. How does that affect them hormonally? Nobody knows. Nobody does studies on chest breathers and estrogen dominance. Like that is
Right.
so far down the list of funding. It's never going to happen. So, but that's the thing. As a smart thinking person, it's always tricky, right? Because you're like, wow, you have this diagnosis, and like, I don't know. Like, I literally have no clue whether the thing I'm teaching you is going to help you. But I think it's helpful to remember too, when you do studies on yoga therapy, you'll see like whatever happens. If it's a really positive result, say I took 50 women with estrogen dominance issues and and assessed them doshically and taught them these practices for 16 weeks, right? And 63% of them improved their situation. Whatever, I'm just making that. It could be anything, right? Which is, you know, equivalent to this Western treatment that they could, like, because that's what it would look like, right? That's exactly what it would look like, something like that. Where, and we see it time and time again when they do yoga studies, people who sort of learn to balance these things like tend to have better outcomes. I mean, the craziest one I ever saw, I talk about all the time because it's like lodged deep in my brain, is this doctor did this study on patients on dialysis. So everyone's on dialysis, and he was like, this is awesome, they can't go anywhere, so they're going to be so compliant because it's hard to do studies. This is how he presented it. He's like, perfect, people on dialysis, they're all dying of kidney failure, they're all on dialysis, awesome. And there was this intervention, and it was like, I thought it was a kind of a cheesy intervention, but like it was a little bit of movement, a little bit of meditation. Everything was based on water because it was the kidneys. I was like, that's, I'm not sure that your water meditation is any different than any other meditation technique, but okay, you know. And they did it like whatever it was, 3 or 4 times a week for a long time. I can't remember the details of that. But what was crazy is the morbidity rate was so much lower in the yoga group. Like it was beyond statistical significance. It was stunning. And we were all like, no. And he's like, I know. There's like a room of like, 100, yoga researchers, he's presenting this thing. And we're like, what the hell? And he's like, I know, right? Because like, you're just sort of seeing if they're like their quality of life would give, you've seen those studies like quality of life, perceived energy levels. But this is like people didn't die, So same kind of thing though. It just shows you like how the power could be in there and you don't even see it coming. The problem you have is you can't really say anything very definitive.
Yeah.
Right? Because like you can't say we know people who do 3 sun salutation aids and a yoga nidra every day have, less hot flashes. When you're talking to practitioners or referral sources, especially, it's good to understand it's like, yes, I understand you're coming from this one way of thinking about it. So yoga therapy comes from Ayurveda, and Ayurveda is really lifestyle medicine. It's getting at disease states long before. Disease states in Ayurveda are much earlier than in Western medicine. They're pre-symptoms, but not, I mean, we're all coming to the same place. Like in Western medicine, we like take blood tests and we're like, oh, guess what? You're sick. You're like, I feel fine, but that's what you want, right? It's like, we're going to give you this medicine so you always feel fine. You're like, that sounds like a good idea. So that's like what we do. It's like we're trying to get ahead of it. So it does get harder when people are deep in symptoms. It can be a little harder, but yeah, meditation fits right in. All the practices we do fit right in. And we don't know hormonal stuff, especially, like we have zero idea. Right, on what affects hormone balances in people. Like the way they study it, it's like there's not a lot of like movement meditation stuff. Yeah, we don't do it the way like regular Ayurveda people do. I give you like the big hits because that's what I've seen actually matters. Like the traditional Ayurvedic like checkbox thing. It confuses you more than helps you in yoga therapy, unfortunately. Like if you've tried it. So we take out all the body stuff and the things that were probably true when people are more genetically similar. And so what you're left with, and a lot of it's like presentation, mental health, stress levels, and the big thing you see over and over again, there's lots of kapha imbalance people, but really in my practice, most people you're like trying to decide whether you're going to balance vata or pitta. Pitta is a little trickier to work with. That's usually the issue. And it's a yoga therapy it's not Ayurveda. So in Ayurveda, let's say you have pitta and too much heat, you directly try to oppose that. You try to cool them down. There's yoga therapy that does that. I've tried it. I've learned it. doesn't work at all, in my opinion. So the way I do it, which is particular to this school, is like this more educational process of how to like get at sensations, everything, thoughts, sensations, heat earlier in the process, and learn to like change yourself right before something becomes a problem. So in the body, it's like controlling heat, a lot earlier process, mentally, it's like control, like seeing anger and disruption of the system arise and having practices in place that help you before it's, manifesting as a disease. I see it as more personal, which is how I think yoga therapists should see it. You have to see it as like, you see it, you already know this. This is what's so interesting. It's like we already know this, but then when we start trying to apply stuff, it's like we get confused. But you already know. It's like you have a friend, right?
Yeah.
They are, not doing well hormonally. They are super type A. They are like stressed out all the time. They are trying to control everything. It's just sort of clear that like the way that they're going about things is not affecting their health well. Like you already know people like that in your life, right? You see it from afar. You don't have to be some sort of like yoga therapy genius. Like that's not going well. So whether it's a matter of like really controlling heat in the body and all those things and inflammation, or whether it's a matter of changing that so that vata isn't as imbalanced, because we know pitta unbalances vata. But the question is, what's the best way to get at it? So if I just tell this person to do diaphragmatic breaths, it's not going to do anything because it's too disrupted from something deeper than that. So that's how I kind of see the vata pitta interplay. And that's worked really well in clinical practice. And that's why I share it. It's not because
Yeah.
I don't have any skin in the game. It's just that I
What's
see all the
worked?
time that works. Right. And when you take like the standard, he's one of my teachers actually, but if you take like the David Frawley book and try to work with asanas for engaging with the different doshas, I mean, you'll see, you get people and it doesn't really change anything for them. So it's like this theoretical thing, but it doesn't really work. Maybe it works on like a really subtle level if you're, like a yogi and you have a very gigantic asana practice and certain practices that are going to like reduce kapha, and you want to reduce kapha, like it might work in that way, but it doesn't work taking people off the street who are like, I'm a
Mhm.
mess, like my periods are all over the place and I'm like emotionally all over the place with them, and I get like super, some months like my cramps are so bad I'm like in bed, and these like symptoms, like it doesn't
Yeah.
work for that. You can't be like, well, headstand reduces, it like doesn't really work. So another example where you'll see that play out, which often has hormonal implications, are headaches, all sorts of headaches, migraines, cluster headache, where it'll be the solution will be very different for different people. This is why I'm not a millionaire. I've done this a long time, but I couldn't write a book that said this is how you deal with cluster headaches, right? Believe me, I've always thought I'm an entrepreneur, as you can see too. So I'd be like, that would be awesome. I could like put out programs, I'd be super rich. Everybody has headaches, right? But there's no way to do it because you need the assessment and you need to tweak it for each person. That's what's so great about yoga, is we thread all this material through it. And then every once in a while, we're like, yeah, that material, don't use it for this condition.
Yeah.
Because if you do this doshic stuff for this condition, it's not going to work. Because we tried it 800 times and it didn't work. So just save yourself the embarrassment. And here's what we do instead. And even in we have a mental health module. I added module 8, it's like a newer module. And in module 8, it's like it's like, I called it like mind types, but it's like a different way to assess people in terms of figuring out what meditations are going to benefit the most. But it's like, oh, and then sometimes we do that. It's like, here's another framework you could try, because everybody's different, right? So you're like, I got this. I totally nailed it. I passed my exam. I doshically balanced them, and you're like, and it didn't work. So you always need new avenues. If it helps to wrap your mind around it, it's the same for anything. So like if you're a PT, right? What makes a great PT is that they switch protocols. They're like, oh, that should have helped you, all that movement I just did. But it didn't, and like the not so great PTs, right, keep doing the same thing. And people get really frustrated. And the great PTs are like, I have another idea, right? So we try to be the same. You want to get more like broad and yoga therapy on it. If the mind controls everything, then any layer, right, can be contributing to an illness or an imbalance. So you can also have like trauma, like like from that perspective, right? Undealt with things in your psyche can cause disease. We don't always start there because you can't just tell everybody that it's undealt with past experiences is why period didn't come at 28 days, like, that's not true. But it could be, so we keep that kind of open mind.